When building a health and safety program, the leader can show the remainder of the organization that safety is important, that he or she cares about safety, and that everyone else should care as well.
We want to keep our facilities safe, we want to keep our staff safe, and we want to keep the residents safe so that everyone enjoys a healthy life.
We have to be really, really cognizant of the fact that we are responsible, and we feel that safety is very, very important because nobody ever wants to get hurt.
A new organization trying to establish a health and safety program and a safe workplace, first and foremost needs to involve its frontline staff in that process. If they're there from the get-go, if they help set it up, if they understand why it's important in their workday, it has a much greater chance of being successful.
Staff buy-in is essential. That's the only way it'll work, is if the staff buy into it. Without the staff, there's no service to the residents. So in order to keep the staff engaged and happy and safe, and then they will deliver the service to the residents.
That's good.
I think most staff understand that in order for them to give good resident care, there are protocols, policies, guidelines required that will help them understand what it takes to be safe in their work, no matter what that work is.
When you try to set up a new program, there's fear. But then as we're getting more into it, and now we're having regular meetings at each site, the staff are aware.
We developed a health and safety policy, and we make that visible everywhere. It's in all of our facilities, it's posted everywhere. It's something that's in each of our new employee packages so that everybody's aware what our health and safety policy is.
We have a variety of things that encourage health and safety. Each site has a health and safety committee, and those committees get together on a quarterly basis and meet as one group, all the foundation. We have health and safety policies, health and safety manuals, a lot of health and safety training. AGF continue to work here?
We do have a formal health and safety program, and because we have so many different buildings, every building has their own health and safety committee, and then those committee members also rotate. So it doesn't become just Sally Joe's responsibility. Pretty soon it's going to be someone else's responsibility to walk their site, to do their hazard assessments, to really think about safety in all aspects in the facility.
Can you guys give me a quick update?
Conveying the message of safety throughout the organization is a challenge, and it's always a challenge, and it really falls back in terms of how effective you can communicate. And we know that staff communicate and receive messages through many different means, whether that's through discussion, looking at posters, chatting one-on-one with colleagues. So our communication strategy is multifaceted.
I really like to have input from the staff, not only just on safety, but on the other policies too, because they're the ones that are actually doing the work. As an organization, you can't just set policies without getting input from the people that are actually doing it, and especially when it comes to safety.
You still have those few staff, and there's not very many, that decide to cut corners, right? They've got the education, they know what the policy is, the procedures are, yet they decide just to rush through. And so that's been a bit of a challenge for us, that we still want to do it through education, but we're finding that some staff need to be taken aside and said, you know what, that isn't how we do things around here.
Well, the one thing we want to do is if there's an incident, we want to make sure that we investigate that incident and we learn from that incident so that we don't ever have that happen again in the organization.
If we have a near miss, we are going to investigate it so that we don't have a near miss again in the future. And so if the staff also have to do the investigations, it makes them fully aware that, you know, oh, you're right, I guess we shouldn't be doing this.
The health and safety is always changing. We're always adding new things to it, new training modules, new learnings, working with the Continuing Care Safety Association to make things better. Okay, well let's hear your ideas for this day.
So resources are always a challenge to come up with. I think we like to look at it that an investment in the health and well-being of our staff and residents has a huge payoff.
If you don't invest in health and safety and you end up having workplace injuries, there's a high cost to that.
If health and safety is important to me, then it's easy for people to see that health and safety needs to be important to them.
It's a real collaborative effort to make sure we can constantly raise the issues, review what the concerns are, and hopefully come up with some innovative approaches.
I think the number one thing is you've got to have buy-in from the top and support from the top, and then if you've got that, I think things get a lot easier.